Minglaba, welcome to Weekends with Susu Thatcher. We have with us today Dr. Stefan Jost, representative from WHO, and Daw Khine Khine Nwe, Secretary General of Myanmar Garment Manufacturers Association and Joint Secretary of UMFCCI. Today we will be discussing the impact of COVID-19 on all of us. And in particular, we will be looking at the fear and the panic factor resulting from the daily experiences that we have from the reports of COVID-19. First, let me welcome you, Dr. Stefan Jost. Thank you very much for joining us. And Daw Khine Khine Nwe, thank you so much for joining us. So we are very rich in having the expert on health, and we're very rich in having an expert on especially on the garment, on the manufacturing sector. So as I was saying, Dr. Jost, a lot of people are panicking. A lot of people are fearful of what COVID-19 would do to them from health perspective. So if you would share with us how we can address that element.
Thank you very much for inviting me, Susu, and delighted to share the panel with distinguished expert from the socio-economic side. Today is World Health Day, 7th of April 2020, and this is actually a good occasion to commemorate all our health workers, first and foremost, especially nurses and midwives who are at the front line. And in fact, the theme of this year's World Health Day is to support and protect our nurses and midwives and do everything we can so that they can do their job well and to help keep us safe from COVID-19. Our health workers, especially nurses and midwives, but indeed all health workers, laboratory staff, hospital staff, ancillary staff, a very big thank you, because without them there would be no response. This is a new virus and it's an unprecedented challenge affecting every sector of society. At the same time, if all of us practice the prevention, social distancing, wash your hands frequently with soap and water, don't touch your face, mouth, nose, eyes unnecessarily, and especially if the hands are not clean. It's very important that we practice these prevention measures systematically to reduce the risk of spread. And that is exactly what we need to do. All of us will help determine the outcome of this. And all of us are part of making it work and pulling through. So therefore, there is actually no reason to panic. It is very important that we keep measured and rational in what we do and just practice the prevention very systematically and consistently.
Thank you for that, Dr. Jost. Sema Daw Khine Khine Nwe, as you are, you work in the garment sector. You know very well that in recent months and recent weeks, there has been a number of people that has been laid off. So again, in that sector, both the employers and the workers are in a state of uncertainty and in a state of fear and concern. As we know, the government is putting in policies and some practical measures. But can you please tell us about how real the fear is about losing jobs?
Supply and demand jar ma no Kongjo ya urania Kongzi Werenia Jarma Nyanyaba Nyani Jamarati Sabra Kongjan Tolo de Jamar Atika Tower Tionanga COVID sapulare no COVID-19 sapularo daga na labanga sa serious pillar no ero Jamaro Nangama Shire a little sound we got Kongzi Kongjan Yashimuga na labanga sabro ne no o ne body where you are the COVID-19 impact ka March ma sala bono sala kajaro the where you rebecca lebe through male terolio where you re purchasing power where you know chadore kajaro through a lady where ya like the kama chamorwa but tama chawaraga konjamia at twe chaware petana taku Piro di konjanga tuning ama taint and at twe Konzi Simupian Salare Chima Konjo women Nanganga Akunalu COVID-19 Giedi Jabiroma Mawere Kajaro Chamornangama Cholung Seunibu Diboti Tromale Nagaga Mamiano no Mamine Kajaro Thra Di Matabi the Chote Mazari or something like that Shibare Chobire Chote Risule Mapone Lujale da Shibare Piroma the car not Mamma or a dragale, they biro Lala Mamiaus a chini pite kajaro, Chamaroma Gunadi, COVID-19 job, Guna Master of Yoga the Bono, or Jamor in sewing more Jamorning and Satilaro, Jowlare, Jowyani, but Taylor Lare, or the panic pillar, no? Taylor Nama, Gunat, or the sewing, Jowlane, Jowyone, Taylor is a pillar by Machamar, Nakupia. And a long shing a lebe. Ngaro issue yati na mam la sure so ye puwa hune thailan la la shi de alou thama ri ka le ngaro alou twi mye ba ma la so bi ro so ye puwa hune thailan la shi de so chuma panic nya swa ja de ma ni ya da ba pai pho tet ko ta su de alou yong myo ri pi ro alou thama short de in a short de alou yong myo ri a aku chain so mani ya thi alou thama won ji thana bo no won ji thana ya de sin ya so yin 150တိရှိနေပါပြီဒီတစ်ခုလုံးခြုံကြည့်လိုက်ရင်အလုပ်သမား9600လောက်ကအလုပ်လက်မဲ့ဖြစ်နေပါပြီဒါကအခုနဒီကျမတို့ရဲ့ဒီ formal sector ပေါ့နော်ဟိုကျမတို့ဒီထုတ်လုပ်မှု sector တခုတည်းမဟုတ်ဘူးဒီ supply chain ဒီကမ္ဘာကုန်စည်စီးမှုလမ်းကြောင်းထဲမှာကထုတ်လုပ်မှုလုပ်ငန်းတခုတည်းမဟုတ်ဘူးဝန်ဆောင်မှုလုပ်ငန်းတွေလည်းပါတဲ့အခါကျတော့ကျမတို့နိုင်ငံမှာရှိတဲ့ hotel industry ကလည်းအရန်ထိခိုက်သွားတယ်ဝန်ဆောင်မှုပေါ့နော်ပိတ်သွားတဲ့ hotel လည်းအများကြီးရှိတယ်ပြီးတော့ဒီကျမတို့ရဲ့ဒီ tourism ပေါ့အဲ့ဒီပြင်ကိုပေါ့အခုနလိုကျမတို့ amusement park တွေပိတ်လိုက်တာမျိုးရုပ်ရှင်တွေပိတ်လိုက်တာမျိုးတွေကြတော့အဲ့မှာရှိတဲ့ခေါင်းရွက်ပြတ်ထိုးဈေးတွေကအစနော်ဒီဟိုကိုယ့်ရဲ့တနတ်မှာရောင်းတော့အဲ့လိုလူတွေအကုန်လုံးကတော့ဟိုအလုပ်တွေရက်သွားကြတယ်တွေကတော့ဒီအခုနကျမပြောတဲ့9600ပြင်ပမှာဖြစ်နေတာပါ
ကျေးဇူးအများကြီးတင်ပါတယ်ဆရာမ So as Siama was saying that, you know, so the fear of what's going to happen to them from health perspective, the uncertainty of their jobs, uncertainty of the business picking up is really impacting not just the garment sector, but also hotel and tourist and other service industries. COVID case was identified. We're now 15 days into it. And as of yesterday, last night, we have 22 cases that has been verified. So, I mean, we have these global figures of 1.2 million. We have these global figures of 64,000 deaths that has been registered. So out of these, you know, some 1,200 that were tested, we have only, if I may use, 22 that were confirmed with the virus. Should we really be that worried? I understand that the government is putting in place systems and processes to contain the virus.
I think it's very important to remember that Myanmar's preparedness and response effort has been very proactive from early on. And also remember we didn't have the capacity to test in country at the beginning of this COVID-19. It took obviously some time to establish that capacity here quickly, which has happened. And since then also testing has gathered pace quite a bit. In fact, it's actually transformed now in terms of the people that are reached for testing. And we support the country, many partners support the country to help ensure that that trend continues, to isolate cases early, to treat them early, and to at the same time practice maximally social distancing measures, reduce travel and other movements. It's very important that we do that. so that there is indeed a slow rise, if any, of cases in Myanmar. That is essential for the problem not to become so big as to be potentially unmanageable, and to make sure that we have more time for preparedness and for response as well as prevention.
If I may, is WHO also assisting with the returns from Thailand?
Indeed, yes, thank you. The whole UN system is engaged. The right measures were taken proactively in order to reduce a sudden influx, and there has also been bilateral, of course, efforts between Myanmar and Thailand on this issue, in addition to the multilateral efforts to support the country in this. But indeed, more support is needed in order to cope with a possible further influx of Myanmar migrants back into the country. The whole idea of a whole UN system response is really to support the country in that whole of society approach. And also other partners come in, non-governmental organizations, ethnic health organizations, community-based organizations that are key to facing this challenge. The more solidarity there is amongst us and between us, the better chance we have to pull through. So it's not only the health response, it's really a whole of society response, and it's very important.
There was an announcement a few days back, or maybe a week or so back, from the UN that that UN will be donating some 50,000 test kits. So what is the status? I think that's part of the UN
yes,
assistance.
that is even part of that comprehensive response.
Right.
It's not only an isolated action, but it is very much based on an interagency, intersectoral approach, and several agencies have come together to make up this big, if you like, contribution. At the same time, we need to look further ahead and plan for further preparedness and response. That is also underway in a comprehensive way, both in the humanitarian side, in the health support side, but also on the socioeconomic side.
On the social media, some are saying that many of the employers are using COVID-19 as an excuse to lay off workers. Is it just a rumor? So what is your view on that?
COVID-19 မဖြစ်ခင်ကတည်းကတချို့သောလုပ်ငန်းတွေကနည်းနည်းလေးပေါ့အခြေအနေအခက်ခဲကြောင့်အစမပြေမှုတွေကြောင့်ပေါ့နော်စီးပွားရေးအရာအစမပြေတာပဲဖြစ်ဖြစ်လုပ်ငန်းလုပ်ကြရတာအစမပြေတာပဲဖြစ်ဖြစ်သူတို့လုပ်ငန်းထဲမှာရှိတဲ့အလုပ်ရှင်လုပ်မှာဆက်ဆံရေးကြောင့်ပဲဖြစ်ဖြစ်အစမပြေမှုတွေတော်တော်များတဲ့အလုပ်ရုံစက်ရုံတွေရှိပါတယ်အဲ့တော့အဲ့ဒီအလုပ်ရုံစက်ရုံတွေကအစမပြေတဲ့ကြားတွေက COVID-19 ကရက်ရိုက်လာတဲ့အခါမှာဦးနာငကိုရှိတဲ့အစမပြေမှုကဒီကရက်ကပို့ပြီးတော့အစမပြေအောင်ကြီးထွားစေပါတယ်ဒါကိုဖြည့်ရှင်းလို့မပြီးရင်မှာထပ်ပြီးတော့ဒီချုပ်တယ်မရတာတို့ချုပ်တယ်အလျှော့ခံရတာတို့ချုပ်ခမရတာတို့ ਨੇ အလုပ်သမားလစာပေးဖို့အခက်အခဲဖြစ်နေတဲ့အလုပ်ရုံတွေကပိတ်သွားကြတာပါတကယ်တော့အမှန်တမ်းပြောရင်လုပ်ငန်းရှင်တွေကကိုယ့်ရဲ့အလုပ်သမားကိုဘယ်သူမှမထုတ်ချင်ပါဘူးကျမပြောရင်လေအခုကျမပြောလိုက်တဲ့151ရုံမှာအလုပ်သမား9000ကျော်အလုပ်လက်မဲ့ဖြစ်သွားတယ်ဆိုတာကျမသိတဲ့အလုပ်ရှင်တော်တော်များများကတော်တော်ကိုစိတ်မကောင်းစွာနဲ့ပိတ်လိုက်ရတာပါစက်ကမထမ်းနိုင်တော့လို့ COVID-19 ကိုအကြောင်းပြပြီးတော့အလုပ်သားလျှော့တယ်ဆိုတော့အဲ့ဒါတော့ကျမလက်မခံပါဘူးဒါပေမဲ့လုပ်သားလျှော့မဲ့အစီအစဉ်မှာ COVID-19 ကြောင့်မလို့ပိတ်လိုက်တဲ့အလုပ်ရုံရှိသလို COVID-19 နဲ့ကြည့်ရိုက်မှုကြောင့်မလို့ပိတ်မဲ့ကိစ္စဟာပို့ပြီးတော့ညံသွားစရာမျိုးလည်းရှိပါတယ်
ဆရာမအဲ့လိုဖြည့်ပြီးတာကျေးဇူးအများကြီးတင်ပါတယ်ဒီမေကွန်းကခဏဒီ social media မှာတက်လာတဲ့အတွက်ကြောင့်မလို့ပေါ့နော်ဆရာမဒီလိုမျိုးသေးစိတ်ရှင်းပြတာကျေးဇူးအများကြီးတင်ပါတယ်